A 7-year-old is brought by his mother, who says that he was well at birth but has been suffering from repeated chest and GI infections since then. She also says that he is not growing well for this age. What is the likely condition for this child? Option A, CF. Option B, SCID. Option C, primary T cell immunodeficiency. Option D, primary B cell immunodeficiency. Option E, malabsorption. So the characteristic features of repeated chest and GI infections, they all indicate primary B cell immunodeficiency. So the correct option here is option D, primary B cell immunodeficiency. It is the correct option. A 3-year-old child has high temperature for 4 days. He had not seen a doctor. The mother notices rashes around buccal mucosa and some around the mouth. What is the most appropriate diagnosis? Option A, measles. Option B, roseola. Option C, rubella. Option D, chickenpox. Option E, impetigo. So correct option here is measles. Fever for 4 days and rashes around the buccal mucosa and some around the mouth. So rashes around the buccal mucosa, it is called Koplik spots. So it is characteristic features of measles. So the correct option here is option A, measles. So other options, roseola infection, rubella, chickenpox, impetigo, so they have not these characteristic features. So buccal mucosa, these Koplik spots around the mouth and a high temperature for 4 days in a 3-year-old child, these all indicate measles. So correct option here is option A, measles. A 70-year-old lady presents with fever for 3 days and confusion. There is no significant past medical history. What is the most probable diagnosis? Option A, delirium. Option B, hypoglycemia. Option C, Alzheimer's. Option D, DKA or diabetic ketoacids. So in 70-year-old lady, presence of fever for 3 days and confusion, they all indicate delirium. So the correct option here is option A, delirium. Presence of fever for 3 days and confusion, so they indicate delirium. The other options, these are wrong. So correct option here is option A, delirium. An obese mother suffers from OSAS. Which of the following investigation is best for her? Option A, ABG. Option B, overnight pulse oximetry. Option C, polysomnography. Option D, EEG. So an obese mother suffers from OSAS. What is OSAS? It is obstructive sleep apnea syndrome. In which person this mother suffers from OSAS? Which of the following investigation is best for her? Option A, ABG. Option B, overnight pulse oximetry. Option C, polysomnography. Option D, EEG. So what is OSAS? It is obstructive sleep apnea syndrome, in which during sleep breathing becomes shallow or it becomes very difficult to breathe during the sleeping. So some most best investigation for this condition is option C, polysomnography. It is the best investigation for obstructive sleep apnea syndrome. So polysomnography is basically, it detects sleep pattern and breathing pattern during the sleep and oxygen level. So it is the most best investigation for this condition. So option C is correct. A 28-year-old businessman came to the sexual clinic. He was worried that he has HIV infection. 3 HIV tests were done and all the results are negative. After a few months, he comes back again and claims that he has HIV. What is the diagnosis? Option A, somatization. Option B, hypochondriac. Option C, Munchausen's. Option D, OCD. Option E, schizophrenia. So person falsely believes that he has some problem, but the results are negative. So he falsely believes that he has some sort of illness. So the correct option here is option B, hypochondriac is the correct option, because it is a condition in which some patients believe that they have some kind of illness, but in reality they have no any illness. So the correct option here is option B, hypochondriac. A 6-week child presents with progressive cyanosis, poor feeding, tachypnea over the first 2 weeks of life, and hollow systolic murmur. What is the most appropriate condition? So, characteristic features of progressive cyanosis, poor feeding, tachypnea, they all indicate tetralogy of flow. So, option E, tetralogy of flow is the correct option. Option E, tetralogy of flow is correct option here. So, because of characteristic features present in a 6-week child like progressive cyanosis, poor feeding and tachypnea, so option E, tetralogy of flow is the correct option. A 29-year-old woman who was diagnosed to have migraine presents with severe onset of occipital headache. She lost her consciousness. CT is normal. Neurological exam is normal. What is the most appropriate management? Option A, repeat CT. Option B, MRI. Option C, lumbar puncture. Option D, X-ray. Option E, no investigation required. So the correct option here is MRI. So CT is normal. So we will perform our next management option is MRI. So option B is correct option. A 19-year-old man has been happier and more positive than usual, with more energy than he has ever felt before for no particular reason. He has been getting more work done at the office today and has been socializing with his friends as usual. What is the most likely diagnosis? Option A, atypical depression. Option B, marked depression. Option C, bipolar syndrome. Option D, psychosis. Option E, hypomania. So our correct option here is option E, hypomania. So its characteristic features are more energy, more positivity, more goal-oriented work, and more happiness. So correct option here is option E, hypomania. It is the correct. Most likely diagnosis is option E, hypomania. A 35-year-old female attempts suicide 10 times. There is no history of psychiatric problems and all neurological exams are normal. What is the best treatment here? Option A, problem focused treatment. Option B, CBT. Option C, antipsychotic. Option D, antidepressant. Option E, ECT. So in a 35-year-old female that has already attempted suicide 10 times and there is no history of psychiatric problem and other neurological exams are normal, so our best treatment here is option B, cognitive behavioral therapy or CBT. It is the best treatment option here for this condition. So correct option here is option B, CBT or cognitive behavioral therapy. A 57-year-old man presents with weight loss, tiredness, fever and abdominal discomfort. Exam is spleen palpable up to the umbilicus. Labs shows WBC 127, that is very high. HB 8.7, platelets 138. What is the most likely diagnosis? Option A, CML. Option B, AML. Option C, CLL. Option D, AML. Option E, polycythemia. So a 57-year-old man presents with weight loss, tiredness, fever and abdominal discomfort. Spleen is palpable, splenomegaly to the umbilicus. Spleen is palpable, it means he has splenomegaly. Labs shows WBC 127, that is very high WBC. HB 8.7, platelets 138. So most likely diagnosis here is option A, chronic myelogenous leukemia or CML. It is the correct option here. So its characteristic features of CML are increased level of WBCs and splenomegaly. These are characteristic features of CML. So correct option here is option A, CML. A baby born at 34 weeks with a heart murmur is kept in the incubator for almost 4 weeks. There is no murmur at discharge. What is the likely cause of this murmur? Option A, PDA or patent ductus arteriosus. Option B, tetralogy of Lohr or TOF. Option C, aneurysm of sinus of Valsalva. Option D, aortopulmonary septal defect. Option E, AVM. So, a baby born at 34 weeks with a heart murmur, kept in incubator for almost 4 weeks. There is no murmur. What is the most likely cause of this murmur? So the correct option here is option A, patent ductus arteriosus. It is the characteristic feature. So aneurysm of sinus of Valsalva. So what is this? Aneurysm of sinus of Valsalva is a feature in which there is some bulge at the aorta, base of aorta. So it is option C. Option A is correct option here. A 6-year-old girl who has previously been well presented with a history of tonic-clonic seizure lasting 4 minutes. Her mother brought her to the hospital and she appeared well. She is afebrile and didn't lose consciousness during the episode of seizure. She has no neurological deficit. What is the most appropriate investigation for her? Option A, ABG. Option B, serum electrolytes. Option C, ECG. Option D, blood glucose. So, a 6-year-old girl, she was previously well and she has history of tonic-clonic seizure for that last for 4 minutes. Her mother brought her to the hospital and she appeared well. She is afebrile and didn't lose consciousness during the episode of seizure. She has no neurological deficit. What is the most appropriate investigation for her? So the correct option here is option B, serum electrolytes. It is the correct option. A 60-year-old woman was found by her son. She was confused and had urinary incontinence. She has recovered fully after 6 hours with no neurological complaints. What is the most likely diagnosis? Option A, stroke. Option B, vestibular insufficiency. Option C, TIA. Option D, intracranial hemorrhage. So so the correct option here is transient ischemic attack or TIA. It is the correct option here. In a 60-year-old woman, she was found by her son. She was confused and had urinary incontinence. She has recovered fully after 6 hours with no neurological complaints. So most likely diagnosis here is transient ischemic attack. It is the correct option here. A 34-year-old woman presents 3 weeks after childbirth. She has had very low mood and has been suffering from lack of sleep. She also has thought of harming her little baby. What is the most appropriate management for this patient? Option A, ECT. Option B, CBT. Option C, IV haloperidol. Option D, paroxetine. Option E, amitriptyline. So a 34-year-old woman presents after 3 weeks after childbirth. She has very depressive disorder. It is called postpartum psychosis or PPS. It is condition where a female has very depressive disorder after postpartum. So the correct option here is it is a psychiatric emergency. So the correct option here is option A, ECT or electroconvulsive therapy. ECT is the management for it is appropriate management for this patient. ECT, electroconvulsive therapy. So the correct option here is option A. A 65-year-old woman presents with headache. She also complains of dizziness and tinnitus. She has recently realized she has visual problems. There is history of burning sensation in fingers and toes. On exam, splenomegaly, itchy after hot bath. Labs shows RBC 87, HB 31.9, platelets 796. What is the diagnosis? Option A, CML. Option B, CLL. Option C, polycythemia vera. Option D, myelofibrosis. Option E, NHL. So a 65-year-old woman, she has headache. She also complains of dizziness and tinnitus. She recently realized she has visual problems. There is history of burning sensation in fingers and toes. On examination, splenomegaly and itchy after hot bath. Labs shows high RBCs high HB, and platelets also high. What is the diagnosis? So the correct option is these are characteristic features of polycythemia vera or high red blood cell counts. So option C, polycythemia vera, is correct option. So characteristic features are visual problems, tinnitus, dizziness, and burning sensation in fingers and toes, and itchy after hot bath. These are all characteristic features of polycythemia vera. In polycythemia vera, there is increase of red blood cells. So the red blood cells level is very high, and HB level is also very high. So why other options are wrong? In CML, there is increased level of WBC. In CLL, there is high level of WBC. So the option C, polycythemia vera, is the correct option here. A 29-year-old male brought to ED in unconscious state. There is no significant past history. Which of the following should be done as the initial investigation? Option A, CT. Option B, blood glucose. Option C, ABG. Option D, MRI. Option E, CBC. So the correct option here is option B, blood glucose. It is the correct option. So a 29-year-old male is brought in unconscious state for first step, and there is no significant past history. So our first initial investigation is to check blood glucose level to rule out hypoglycemia, because hypoglycemia is main reason for unconscious state. So option B, blood glucose, is the correct option here. A 45-year-old woman comes with red, swollen and exudating ulcer on the nipple and areola of right breast with palpable lump under the ulcer. What do you think is causing this skin condition? Option A, inflammatory cells releasing cytokines. Option B, infiltration of the lymphatics by the carcinomatous cells. Option C, infiltration of the malignant skin cells to the breast tissue. So this condition in a 45-year-old woman with red, swollen and exudating ulcer on the nipple and areola of right breast with palpable lump under the ulcer. What do you think is the causing this skin condition? So the correct option here is option C, infiltration of the malignant skin cells to the breast tissue. It is the most likely condition. Option C is correct option. This condition is Paget disease of the breast, so in which infiltration of malignant cells to the breast tissue takes place, and the characteristic features are red, swollen and exudating ulcers on the nipple and areola of right breast with palpable lump under the ulcer. So this condition is Paget disease of breast. So option C is the correct option. A 20-year-old young lady comes to the general physician for advice regarding cervical cancer. She is worried as her mother passed away because of this. She would like to know what is the best method of contraception in her case. Option A, POP. Option B, barrier method. Option C, IUCD. Option D, COCP. Option E, IUS. So a 20-year-old young lady comes to general physician for advice regarding cervical cancer. She is worried as her mother passed away because of this. She would like to know what is the best method of contraception in her case. So option B, barrier method, is the correct option here. So in this case, barrier method is correct best contraception method. So option B is correct. A 66-year-old man an hour after hemicolectomy has a urine output of 40 ml. However, an hour after that, no urine seemed to be draining from the catheter. What is the most appropriate next step? Option A, IV fluids. Option B, blood transfusion. Option C, dialysis. Option D, IV furosemide. Option E, check catheter. So the correct option here is option E, check catheter. It is the correct option. So a 66-year-old man has hemicolectomy procedure, where is part of large intestine is removed and urine output is 40 ml. After an hour that no urine seemed to be draining from the catheter. So next step is check catheter. So option E is correct. A 24-year-old patient presented with anaphylactic shock. What would be the dose of adrenaline? Option A 0.5 ml of 1:1000. Option B 0.5 ml of 1:10,000. Option C 1 ml of 1:500. Option D 5 ml of 1:1000. Option E 0.05 ml of 1:100. So a 24-year-old patient that is presented with anaphylactic shock. So dose of adrenaline is option A 0.5 ml of 1:1000. It is the correct option. Option A is correct option here. A 44-year-old woman complains of heavy bleeding per vagina. Transvaginal ultrasound was done and normal. Which of the following would be the most appropriate investigation for her? Option A hysterectomy. Option B endometrial biopsy. Option C CBC. Option D high vaginal swab. Option E coagulation profile. So option B endometrial biopsy, it is the correct option here. In a 44-year-old woman that complains of heavy bleeding per vagina, transvaginal ultrasound was normal. So most appropriate investigation for her is option B endometrial biopsy. A 60-year-old woman presented to OPD with dysphagia, no history of. A 60-year-old woman presented to OPD with dysphagia, no history of weight loss or heartburn, no change in bowel habits while doing endoscopy. There is some difficulty passing through the lower esophageal sphincter, but no other abnormality is noted. What is the single most useful investigation? Option A CXR, option B MRI, option C esophageal biopsy, option D esophageal manometry, option E abdominal X-ray. So the correct option here is option D esophageal manometry is most useful investigation. A 60-year-old woman presented in OPD with dysphagia, that is difficulty of ingesting food, and no history of weight loss or heartburn, no changes in bowel habits while doing endoscopy. There is some difficulty passing through the lower esophageal sphincter, but no other abnormalities noted. What is the most useful investigation? So the most useful investigation here is option D esophageal manometry. A 24-year-old woman presents with deep dyspareunia and severe pain in every cycle. What is the initial investigation? Option A laparoscopy, option B pelvic ultrasound, option C hysteroscopy, option D vaginal swab. So the correct option here is option B pelvic ultrasound. So here is some terms. Dyspareunia. What is dyspareunia? It is a condition where painful sexual intercourse. It is condition in which there is extreme pain during the sexual intercourse, and she is 24-year-old woman. She presents with deep dyspareunia and severe pain in every cycle. So the correct investigation here is option B pelvic ultrasound. A 38-year-old woman 10 days postpartum presents to GP with history of passing blood clots per vagina since yesterday. Exam blood pressure 90/40, pulse 110, temperature 38, uterus standard on palpation and fundus 2 cm above umbilicus. Blood clots positive, shows the single most likely diagnosis. Option A abruption of placenta second to preeclampsia. Option B concealed hemorrhage. Option C primary postpartum hemorrhage. Option D secondary postpartum hemorrhage. Option E retained placenta. Option F scabies. So the correct option here is option D secondary postpartum hemorrhage. So in a 38-year-old woman 10-day postpartum present with passing blood clots per vagina, and so these all indicate secondary postpartum hemorrhage. So the correct option here is option D. A 32-year-old female with 3 previous first trimester miscarriages is diagnosed with antiphospholipid syndrome. Anticardiolipin antibodies are positive. She is now 18 weeks pregnant. What would be the most appropriate management? Option A, aspirin. Option B, aspirin and warfarin. Option C, aspirin and heparin. Option D, heparin only. Option E, warfarin. So correct option here is option C, aspirin and heparin. It is combined therapy for treatment of antiphospholipid syndrome. So anticardiolipin antibodies are positive. So the most appropriate management here is aspirin and heparin combined therapy. So option C is correct here. A 23-year-old presents with vomiting, nausea and dizziness. She says her menstrual period has been delayed for weeks as she was stressed recently. There are no symptoms present. What is the next appropriate management? Option A, refer to OP psychiatry. Option B, refer to OP ENT. Option C, CT brain. Option D, dipstick for beta HCG. Option E, MRI brain. So correct option here is option D, dipstick for beta HCG. So in a 23-year-old, presence of vomiting, nausea and dizziness and delayed menstrual period for 4 weeks, these indicate pregnancy. So the next appropriate management here is dipstick for beta HCG. So option D is correct. A 16-year-old girl came to the sexual clinic. She complains of painful and heavy bleeding. She says she doesn't have a regular cycle. What is the most appropriate management? Option A, mini pill. Option B, combined pill. Option C, IUS. Option D, antiprostaglandins. Option E, antifibrinolytics. So in a 16-year-old girl with painful and heavy bleeding, the most appropriate management here is option B, combined pill. So option B is correct. A 36-year-old man walks into a bank and demands money, claiming he owns the bank. On being denied, he goes to the police station to report this. What kind of delusion is he suffering from? Option A, delusion of reference. Option B, delusion of control. Option C, delusion of guilt. Option D, delusion of persecution. Option E, delusion of grandeur. So the correct option here is option E, delusion of grandeur. Delusion, it is a false perception of grandiosity. So option E is correct here. Which method of contraception can cause the risk of ectopic pregnancy? Option A, COCP. Option B, IUCD. Option C, Mirena. Option D, POP. So the contraception that can cause the risk of ectopic pregnancy is Mirena. So option C, Mirena, is correct option. A woman has pernicious anemia. She has been prescribed parenteral vitamin B12 treatment, but she is needle phobic. Why is oral treatment not preferred for this patient? Option A, IM B12 is absorbed more. Option B, intrinsic factor deficiency affects oral B12 utilization. Option C, IM B12 acts faster. Option D, IM B12 needs lower dosage. Option E, pernicious anemia has swallowing difficulties. So a woman has pernicious anemia. Pernicious anemia is a condition, it is an autoimmune condition where body cannot absorb B12, vitamin B12. So RBCs are not produced well. It is due to intrinsic factor deficiency. So for this patient, option B, intrinsic factor deficiency affects oral B12 utilization. So this is correct option. Option B is correct option here. An old man comes to the doctor complaining that a part of his body is rotten and he wants it to removed. What is the most likely diagnosis? Option A, guilt. Option B, hypochondriasis. Option C, Munchausen's. Option D, nihilism. Option E, Capgras. So the correct option here is option D, nihilism. It is correct option. The condition is an old man is complaining that a part of his body is rotten and want it removed. It is a misconception. So these characteristic features are in nihilism. So correct option here is option D, nihilism. A 31-year-old woman who is 32 weeks pregnant attends the antenatal clinic. Labs HB 10.7, MCV 91. What is the most appropriate management for this patient? Option A, folate supplement. Option B, ferrous sulfate 200 mg per oral. Option C, iron dextran. Option D, no treatment requirement. So in the third trimester, 31-year-old woman, she is in third trimester. HB is 10.7, which is in normal range. MCV is 91, that is also in the normal range. So the most appropriate management for this patient is no treatment requirement. Option D, it is the correct option. A 47-year-old man who is a chronic alcoholic with established liver damage has been brought to the hospital after an episode of heavy drinking. He is not able to walk straight and is complaining of double vision and is shouting obscenities and expletives. What is the most likely diagnosis? Option A, Korsakoff psychosis. Option B, delirium tremens. Option C, Wernicke's encephalopathy. Option D, Tourette's syndrome. Option E, alcohol dependence. So the correct option here is option C, Wernicke's encephalopathy. So a 47-year-old chronic alcoholic patient, he has also established liver damage and brought to hospital after episode of heavy drinking. He is not able to walk straight and complaining of double vision and shouting obscenities and expletives. So the most likely diagnosis here is Wernicke's encephalopathy. Wernicke's encephalopathy is due to thiamine deficiency. So its treatment is thiamine. So correct option here is option C, Wernicke's encephalopathy. A 32-year-old woman of 39 weeks gestation attends the antenatal day unit feeling very unwell with sudden onset of epigastric pain along with nausea and vomiting, temperature 36.7, exam right upper quadrant tenderness, bloods, mild anemia, low platelets, elevated LFT and hemolysis. What is the most likely diagnosis here? Option A, acute fatty liver of pregnancy. Option B, acute pyelonephritis. Option C, cholecystitis. Option D, HELLP syndrome. Option E, acute hepatitis. So the correct option here is option D, HELLP syndrome. So correct in a 32-year-old woman, 39 weeks of gestation. So presence of epigastric pain along with nausea and vomiting, and blood shows mild anemia, low platelets and elevated liver function test. All these signs show, and right upper quadrant tenderness, and all these symptoms, they indicate HELLP syndrome. So correct option here is option D, HELLP syndrome. A 57-year-old woman presents with dysuria frequency and urinary incontinence. She complains of dyspareunia. Urine culture has been done and is sterile. What is the most appropriate step? Option A, oral antibiotics. Option B, topical antibiotics. Option C, topical estrogen. Option D, oral estrogen. Option E, oral antibiotics and topical estrogen. So correct option here is option C, topical estrogen. A 57-year-old woman presents with dysuria or painful urination and frequency urinary incontinence and complaints of dyspareunia or painful sexual intercourse. Urine culture has been done and it is sterile. The appropriate step is topical estrogen. Option C is correct here. A patient came to the ED with severe lower abdominal pain, vitals blood pressure 125/85, temperature 38.9, exam abdomen rigid, very uncomfortable during pervaginal. She gave a past history of PID 3 years ago, which was successfully treated with antibiotics. What is the appropriate investigation? Option A, ultrasound. Option B, abdomen X-ray. Option C, CT. Option D, high vaginal. Option E, endocervical swab. So the most appropriate investigation is option A, ultrasound. It is the correct option here. So patient came in ED with severe lower abdominal pain. Vitals are within normal range. Exam, abdomen is rigid, very uncomfortable during parvaginal. She gave past history of PID 3 years ago, and that was successfully treated with antibiotics. So the appropriate investigation is option A, ultrasound. A pregnant woman with long-term history of osteoarthritis came to the antenatal clinic with complaints of restricted joint movement and severe pain in her affected joints. What is the choice of drug? Option A, paracetamol. Option B, steroid. Option C, NSAID. Option D, paracetamol plus dihydroquine. Option E, pethidine. So correct choice of drug here is option A, paracetamol. It is the correct option. A pregnant woman with long-term history of osteoarthritis with restricted joint movement and severe pain and affected joint. So choice of drug here is option A, paracetamol. So it is the correct option. A 24-year-old 18-week pregnant lady presents with pain in her lower abdomen. For the last 24 hours, she had painless vaginal bleeding. Exam, abdomen is tender, OS is closed. What is the most probable diagnosis? Option A, threatened miscarriage. Option B, inevitable miscarriage. Option C, incomplete miscarriage. Option D, missed miscarriage. Option E, spontaneous miscarriage. So the correct probable diagnosis is option A, threatened miscarriage. A 24-year-old 18-week pregnant lady presents with pain in her lower abdomen. For the last 24 hours, she had painless vaginal bleeding. On examination, abdomen is tender, OS is closed. The most likely probable diagnosis here is option A, threatened miscarriage. So option A is correct. A 2-year-old child playing in the garden had a clean cut. She didn't have any vaccinations. Also, there is no contraindication to vaccinations. Parents were worried about the vaccine side effects. What will you give? Option A, clean the wound and dress it. Option B, give TT only. Option C, give DPT only. Option D, give DPT and tetanus IG. Option E, give complete DPT vaccine course. So option E, give complete DPT vaccine course. It is the correct option. So a 2-year child, he was playing in the garden and had a clean cut. She didn't have any vaccinations and no contraindication to vaccination. So the most appropriate next step is option E, give complete DPT vaccine course. A 32-year-old female who has had 3 previous miscarriages in the first trimester now comes with vaginal bleeding at 8 weeks. Ultrasound reveals a viable fetus. What would be the most appropriate definite management? Option A, admit. Option B, aspirin. Option C, bed rest 2 weeks. Option D, cervical cerclage. Option E, no treatment. So the female age is a 32-year-old female. She had 3 previous miscarriages in first trimester, now come with vaginal bleeding 8 weeks. Ultrasound reveals a viable fetus. What would be the most appropriate definite management? So the most appropriate definite management is option E, no treatment. It is the correct option here. A 6-year girl started wetting herself up to six times per day. What is the most appropriate treatment? Option A, sleep alarms. Option B, desmopressin. Option C, reassure. Option D, behavior training. Option D, imipramine. So the correct option here is option C, reassure. It is the correct option. A 27-year-old 34-week pregnant lady presents with headache, epigastric pain and vomiting. Exam, pulse 115, blood pressure 145 or 95. Proteinuria positive. She complains of visual disturbances. What is the best medication for the treatment of the blood pressure? Option A, 4 gram MGS4 in 100 ml, 0.9% NS in 5 minutes. Option B, 2 gram MGS4 IV bolus. Option C, 5 milligram hydralazine IV. Option D, methyl dopa 500 milligram 8 hours per oral. Option E, no treatment. So first we will understand the MCQ. A 27-year-old 34-week pregnant lady. So she is in third trimester. She presents with headache, epigastric pain and vomiting. Exam is pulse 115, blood pressure 145, proteinuria positive. She complains of visual disturbance. What is the best medication for the treatment of the blood pressure? So correct option here is option C, 5 mg hydralazine IV. It is the correct option. A 24-year-old lady who is 37-week pregnant was brought to the ED. Her husband says a few hours ago she complained of headache, visual disturbance and abdominal pain. On arrival at the ED, she has a fit. What is the next appropriate management for this patient? Option A, 4 gram MGS4 in 100 ml, 0.9% NS in 5 minutes. Option B, 2 gram MGS4 IV bolus. Option C, 2 gram MGS4 in 500 ml and normal saline in 1 hour. Option D, 4 gram MGS4 SO4 IV bolus. Option E, 10 mg diazepam in 500 ml, 0.9% normal saline in 1 hour. First we will understand this MCQ. So 24-year-old lady, she is 37-week pregnant. She is in her third trimester, was brought to the emergency department. Her husband says she complained of headache, visual disturbance and abdominal pain. On arrival at the ED, she has a fit. So next appropriate management for this patient is option D, 4 gram MGSO4 IV bolus. It is the correct option. What is the pathological change in Barrett's esophagitis? Option A, squamous to columnar epithelium. Option B, columnar to squamous epithelium. Option C, dysplasia. Option D, metaplasia. Option E, hyperplasia. So the correct option here is option A, squamous to columnar epithelium. It is the pathological change in Barrett's esophagitis from squamous epithelium to columnar epithelium. A 34-year-old male presents with history of headache, presents with ataxia, nystagmus, vertigo. Where is the site of this lesion? Option A, auditory canal. Option B, 8th cranial nerve. Option C, cerebellum. Option D, cerebral hemisphere. Option E, brainstem. So now we will understand this MCQ. A 34-year-old male presents with history of headache, ataxia, nystagmus and vertigo. Where is the site of the lesion? Option A, auditory canal. Option B, 8th cranial nerve. Option C, cerebellum. Option D, cerebral hemisphere. Option E, brainstem. So the site of lesion is cerebellum. Option C is the correct option. Presence of ataxia, nystagmus and vertigo. So these lesions are present in cerebellum. So option C, it is the correct option. A 24-year-old girl comes to a women's sexual clinic and seeks advice for contraception. She is on sodium valproate. Option A, she can't use COCP, combined oral contraceptive pills. Option B, she can use combined oral contraceptive pills with extra precaution. Option C, she can use COCP if anticonvulsant is changed to carbamazepine. Option D, she can use COCP with estrogen 550 microgram and progesterone higher dose. Option E, she can use COCP. So now we will understand this MCQ. A 24-year-old girl comes to women's sexual clinic and seeks advice for contraception. She is on sodium valproate. So the correct option here is option C. She can use combined oral contraceptive pills if anticonvulsant is changed to carbamazepine. Option C is correct. A 27-year-old lady came to the ED 10 days ago with fever, suprapubic tenderness, and vaginal discharge. PID was diagnosed. She has been on the antibiotics for the last 10 days. She presents again with lower abdominal pain, temperature 39.5. What is the most appropriate next management? Option A, vaginal swab. Option B, endocervical swab. Option C, ultrasound. Option D, abdominal X-ray. Option E, laparoscopy. So now we will understand the MCQ. A 27-year-old lady came to the emergency department 10 days ago with fever, suprapubic tenderness, and vaginal discharge. PID was diagnosed pelvic inflammatory disease. She has been on the antibiotics for the last 10 days. She presents again with lower abdominal pain. Temperature is 39.5. What is the most appropriate next management? So next appropriate management is ultrasound. Option C, ultrasound. It is the correct option. An 18-year-old man complains of fatigue and dyspnea. He has left parasternal heave and systolic thrill with a harsh pan-systolic murmur at left parasternal edge. What is the most probable diagnosis? Option A, tetralogy of flow. Option B, atrial septal defect. Option C, ventricular septal defect. Option D, PDA. Option E, TGA. So the presence of harsh pan-systolic murmur is characteristic feature of ventricular septal defect. So the correct option here is option C, ventricular septal defect. So presence of harsh pan-systolic murmur or hollow systolic murmur, these two are characteristic features of ventricular septal defect. So 18-year-old, he complains of fatigue and dyspnea and left parasternal heave. So most probable diagnosis is ventricular septal defect. A young girl presenting with fever, headache, vomiting, neck stiffness, and photophobia. She has no rashes. What is the most appropriate test to confirm diagnosis? Option A, blood culture. Option B, blood glucose. Option C, lumbar puncture. Option D, CXR. Option E, CT. So a girl presenting with fever, headache, vomiting, neck stiffness, and photophobia. These are all characteristic features of meningitis. So most appropriate test to confirm diagnosis is lumbar puncture. Lumbar puncture is most appropriate test to confirm the diagnosis. So option C, LP, is the correct option here. A 65-year-old hypertension man wakes up in the morning with slurred speech, weakness of the left half of his body, and drooling. Which part of the brain is affected? Option A, left parietal lobe. Option B, right internal capsule. Option C, right midbrain. Option D, left frontal lobe. So now we will understand this MCQ. A 65-year-old hypertension he has high blood pressure. He wakes up in the morning with slurred speech, weakness of the left half of his body, and drooling. Which part of the brain is affected? So the correct option here is option B, right internal capsule. It is the correct option. Option B is the right option.